Treating a vaginal infection depends on the specific type of infection you have. The most common types of vaginal infections include yeast infections, bacterial vaginosis, BV, and trichomoniasis. Here's a general guide on how to treat each type. Yeast infection. Over-the-counter antifungal medications. Most yeast infections can be treated with over-the-counter antifungal creams, suppositories, or tablets, such as miconazole, clotrimazole, or tiaconazole. Follow the instructions on the package carefully. Prescription medication. In some cases, your doctor may prescribe stronger antifungal medications if over-the-counter treatments aren't effective. Avoid irritants. Avoid using scented soaps, bubble baths, or douches, as they can disrupt the natural balance of bacteria and yeast in the vagina and worsen the infection. Bacterial vaginosis, BV. Antibiotics. BV is typically treated with prescription antibiotics, such as metronidazole or clindamycin. These medications can be taken orally or applied vaginally as a gel or cream. Finish the full course. It's important to complete the full course of antibiotics, even if your symptoms improve before you finish the medication. Avoid irritants. Similar to yeast infections, avoid using scented products in the vaginal area, as they can disrupt the balance of bacteria. Trichomoniasis. Prescription medication. Trichomoniasis is usually treated with prescription oral antibiotics, such as metronidazole or tinidazole. Your sexual partners may also need treatment. Abstain from sex. It's important to abstain from sexual activity until you and your partners have completed treatment and are no longer contagious. Avoid alcohol. Avoid consuming alcohol while taking metronidazole or tinidazole, as it can cause severe nausea and vomiting. In addition to specific treatments for each type of infection, here are some general tips for managing vaginal infections. Practice good hygiene. Keep the vaginal area clean and dry. Avoid using scented products or harsh soaps, as they can irritate the delicate tissues. Wear breathable cotton underwear. Avoid tight-fitting underwear and clothing that can trap moisture and promote the growth of bacteria and yeast. Avoid douching. Douching can disrupt the natural balance of bacteria and yeast in the vagina and increase the risk of infection. Eat a healthy diet. Eating a balanced diet rich in fruits, vegetables, whole grains, and probiotic-rich foods, such as yogurt, can help support vaginal health. Follow up with your healthcare provider. If your symptoms persist or worsen despite treatment, follow up with your healthcare provider for further evaluation and management. It's essential to see your healthcare provider for an accurate diagnosis and appropriate treatment if you suspect you have a vaginal infection. They can determine the underlying cause of your symptoms and recommend the most effective treatment for